as we get set for another Blanche River Health Hospital Foundation chat. Cassandra James, Executive Director, in studio. Good morning, Cassie.
Good morning, Fergie.
And you brought a special guest with you this morning. Do the introduction for us.
Oh, I'm very excited to welcome Ryan Clarke from Alamos Gold. He is the General Manager at the Young-Davidson site, and we have some special news today.
Good morning, Ryan. How are you?
Good morning, Fergie. I'm very well, thank you. Morning, Cassie. Thank you for inviting me along today.
Happy to get you up nice and early today, Ryan.
Yes, indeed. Get the boss out of bed a little early this morning.
He was up hours before me. I just like to razz him.
So, I'm told you guys have a big announcement for us today.
Yes, so...
I'm in my comfortable chair. I'm ready.
We're going to get to hear it first. We have successfully completed the ER Wait Clock Fundraiser thanks to a significant donation from Alamos Gold Young-Davidson mine. Yay! Yay. Tell them how much you donated, Ryan.
Okay, Alamos is very proud to contribute just over $43,000 to this project.
Wow.
That amount consists of the completion of the capital campaign goal, but also covers the first year of operation for those clocks, so they can get up and running right away.
Right on.
Yes.
Right
round of applause.
So, Cassie, for those who might not be aware of this project, what exactly are these ER wait clocks, and when can we run up to the ER and check them out?
So the clocks are digital screens in the emergency department that show the current estimated wait time to see a physician. So the system doesn't change how long you wait, because that obviously can't be controlled by a clock, but it does predict and display the wait times and the number of patients waiting. That gives patients a real-time information. So the clocks will be in place this month or next month, now that we have all the funding. There'll be one in Kirkland Lake and one in the Englehart Emergency Department waiting rooms. And it'll be rolled out in two phases. So phase one will show the wait times on the screens in the ER waiting rooms, and then phase two will actually make those same clocks accessible online, so people with non-urgent needs can check before headed up to the emergency department.
So, what kind of difference does it make for patients and families and whatnot?
Well, it's really about reducing stress, right, Fergie? So when you're in the ER, not knowing how long you can wait can really add to the anxiety. So we've done a lot of research. We've seen a lot of examples. These are actually fairly common across Southern Ontario now. And what it's saying is having a clear, reliable estimate gives people a sense of control, lets them plan around non-urgent visits, and helps them really focus on getting the care they need instead of worrying about the unknown. The hospital will be publishing more details about the clocks on their website and on their social media, so keep an eye on that.
Okay, now, one thing just popped into my head here. So we have these clocks that tell us, so I go in, I triage and whatnot, it tells me I might have, say, a 4-hour wait.
Yeah.
Can I then leave and monitor online and come back?
So technically the way the emergency department works is that patients are to stay at the hospital. Okay. So if you did want to sit, there is the front lobby emergency room. You can let CR, Central Registry, know that if you're sitting in a different room, but you are to stay. If you do leave the hospital, it does take you out of the triage queue.
So even if someone just wanted to sit outside, enjoy some sun for a half hour or something, they would lose their spot in the line?
Yes, technically, yeah.
Okay, yeah. That answers that. Ryan, what stood out about this project and about its immediacy, how practical this ER wait clock will be?
Yeah, that's just it, Fergie. It is so practical and so immediate in terms of its impact. We did a bunch of polling of our employees at Young-Davidson, and one of the concerns they had, healthcare in the region, was just the wait times in the emergency room. So, in listening to their concerns, when this opportunity was brought forward by Blanche River Health, it really piqued my interest, and that was something that could really affect my employees. So really making sure that people could get the needs met that they had, and that we could have an impact on that benefit for them.
Now, I know, Ryan, Alamos is a great corporate sponsor. You guys are involved in absolutely everything. People come in, they make a request. More often than not, you guys meet that request for them. What about local health care is so important to Alamos to make you guys get involved in projects like this?
Yeah, we look at things from a community investment perspective, and local healthcare is a really big part of one of those core pillars of investment that we can make from Alamos's perspective that keeps our community strong. So we want to support projects like this that are just more than just about today's needs. They're about building a community, a place where our employees and their families and our neighbors can count on that support for years to come. Partnering with Blanche River Health and its foundation really gives us a chance to be a part of that, and just collaborate with organizations in the area and just build something stronger together.
Well, our residents in the area are lucky to have a company like you guys.
100%. We're so
supporting
grateful.
the community. Now, Cassie, I think I read somewhere that this whole ER Clock campaign started with a donation from a local resident.
Yes, yeah,
right?
Exactly. So speaking of community, to piggyback a little bit off what Ryan said, Sharon Eady was born and raised in Kirkland Lake, and she actually worked as a healthcare professional until her retirement.
Okay.
And so she did actually pass away earlier this year, and I'm thrilled to share that, because of her generous donation that she left last year, she was actually the kickstart to this campaign, one that she, when she was donating her money, felt very excited about from the impact on the community. So her gift inspired others to give and got that campaign rolling. And, so you see the community impact there and the community coming together. Her kindness and vision was the spark, and Alamos Gold Young-Davidson really stepped up and brought it home.
Right on. So we're going to see these clocks installed shortly.
Yes. Yeah.
Very shortly. Get all fired up about this.
Yeah. Well, and, quick note is that Temiskaming Hospital also just got theirs going because we partnered with the same provider so that we could bring the best possible cost for this initiative. And so they've got theirs going, and we're just minutes behind now that we've got all the support from Alamos.
Right on. Ryan, any final thoughts for the millions and millions and millions of people listening this morning?
Yeah, really, just that Alamos is honored to be a partner with Blanche River Health and Blanche River Health Foundation on this project, and we really look forward to working together on future initiatives as well that strengthen healthcare in our communities.
Right on. Thanks for stopping by this morning, Ryan. It's been a real pleasure. Cassie, you get the last word today.
Well, I'm going to give my monthly thank you to the communities. Everybody's doing a great job donating, whether it's through the Grateful Hearts program at grateful.brhfoundation.ca, buying those Split the Pot lottery tickets, or helping us getting our message out on social media by sharing those posts. Every action is bringing this down the path to great health care. And just a reminder to keep an eye on the Blanche River Health website. So that's blancheriverhealth.ca for more information about the ER clocks.
All right. Do you have any, anybody at Split the Pot?
I know people who have won.
No. Do you know anybody in charge of pulling the numbers out?
I think they keep that secret from me. Someday, Fergie, it's going to happen.
Because I keep wondering, did my cell phone break or something? Is the battery dead? They haven't phoned me yet.
I will tell you good news. We had 2 more early bird winners in the month of August that I'll be announcing shortly. So there is getting more frequent for up north winners.
Is my name on the list?
Your name is not quite there yet. That's the joy of lotteries. Playing the game.
They're starting to drive me crazy now.